I'm Dr. Bill Johnson of Innovations Medical in Dallas and Fort Worth, and I'm here this morning to introduce you to a technology I'm very excited about known as Liposonics. Over the last several years, I've done over 2,000 liposuction cases, and it's become apparent that there's a group of patients that really don't want to have surgery, but would really benefit from liposuction style changes. Now we can do that with Liposonics. Liposonics in the right patient can give results very similar to liposuction without the surgery by doing it through the skin without an incision. Since there have been men and women, we've always wanted to have the ability to get smaller here without getting smaller everywhere, or even if we worked out and got exactly the size we wanted, there'd be one spot that you'd want to get a little smaller or a little more shapely. Up until now, the only way to get there was liposuction, have surgery and go actually remove the fat in that localized area. Now that's changed with Liposonics. The technology of Liposonics uses ultrasound, just very similar to imaging ultrasound like an obstetrician would use with a pregnant woman, with one important difference. Where imaging ultrasound is unfocused, it's kind of like putting a sheet of paper out in the sun. The Liposonics focuses the energy just as you would use the magnifying glass to focus the sun's light on a piece of paper outside. That focusing allows the ultrasound to get much higher energy in a specific level and disrupt the fat cells so that they're permanently eliminated from the body. Well, your body has a very specific way of taking care of injured cells, and that's what's happened with these disrupted fat cells. The body sends out signals, and special cells called macrophages come in. They absorb the fat and the debris from the fat cells that have been released as a result of the Liposonics, and then those macrophages carry that back to the liver. The liver then takes that material that the macrophages bring and uses it wherever the body needs that material to be used in the future. The ideal candidate for Liposonics has no significant health problems, no uncontrolled diabetes, hypertension. You could have high blood pressure, diabetes, but they need to be well controlled. That person needs to have an inch of fat in the treatment area. You should be able to pinch your skin and have an inch of fat. If you don't have an inch of fat, then that area shouldn't be treated. And then a body mass index of 30 or less. CDC has a body mass index calculator that you can go to our website and link to. Patients can expect an improvement in their waist size of between 1.5 and 2 inches after about 6 weeks. And there's probably going to be some long-term further improvement after that, as long as the patients don't gain weight. The procedure itself takes about an hour. You'll be marked by the physician or technician, and then while lying on the table, the handle that has the treatment device will be placed on the markings and moved periodically as the energy is delivered. You may feel a little bit of discomfort during some of this time, and you'll be asked to move back and forth so that we can treat all of the areas. Liposonics is well tolerated. There is a little bit of discomfort during the procedure, and some patients may require some medication to make it more comfortable. But most patients can go home that same day without any further assistance. There's a little swelling afterwards, pretty minor, usually no larger than you were to begin with, and some occasional bruising. We recommend that you wear a compression garment for about a week afterwards to help minimize the swelling, and that you abstain from your usual exercise routine for that first week. After that, you should be able to return to normal activities, and most people are able to go back to work the day after the procedure. It's very important to understand that Liposonics is not a weight loss device. While the fat cells are destroyed, the fat itself is not. And your body will reutilize that fat wherever it's needed in cells throughout the body, but you will not see a change in weight after having Liposonics performed. Certainly one of the major differences is liposuction requires surgery and incisions, and Liposonics does not. But it's also important to understand some of the other differences. One, Liposonics doesn't have as many size restrictions. We can do it on areas of thinner fat, and we can do it on areas of much thicker fat that Liposonics would not do a very good job with. We can shape and sculpt more efficiently and to a better extent with liposuction than I can with Liposonics. I can give a patient a washboard stomach if they want a great six-pack when I'm doing liposuction, but you really can't do that kind of sculpting with Liposonics. Then the other thing to remember is that either one of these procedures are still susceptible to future weight gain. The areas treated with liposuction or with Liposonics are not going to be the first place you put fat anymore. But if you gain enough weight, you can still put fat back in the areas after either procedure.